Welcome to the Why Did I Get Cancer podcast. I'm Deborah Herlax-Enos, a small-town girl turned TV nutritionist and healthy living expert. I design health programs for the average guy or gal, including those average guys named Metallica. On September 1st, 2020, I was diagnosed with breast cancer. I asked every oncologist the same question, why did I get cancer? But none of my doctors had good answers for me. I wanted answers, and that's why I started this podcast. I want to help you to lower your cancer risk and provide self-care tips for those in the battle. I'm getting answers, and I want to share them with you. What did I take away from today's episode? That cancer is now the leading cause of death in our children. Dr. Connealy is very clear that it is time to sound the alarm. She gave us some great tips on how to prevent cancer, including that it takes 10 years for a cancer cell to turn into a tumor. Tune in to today's episode to get Dr. Connealy's tips on what you can do to prevent cancer. Today's guest, I'm so thrilled that you're on my podcast called Why Did I Get Cancer? Dr. Connealy is leading a cancer prevention revolution, which focuses on treating the patient with the disease and not the disease. And when I heard that, I just thought, oh my gosh, I need to talk to her. So welcome to Why Did I Get Cancer?
Thank you so much for having me.
Yes. And of course, during my cancer journey, I did not feel like a whole person. I just felt like a breast for over a year. And can you tell us a little bit about what it means to treat the whole person?
Well, we are one entire biological system, and unfortunately, medicine has gotten fragmented into body parts. So we have doctors who are specialists, so they might be a GI specialist, cardiologist, neurologist, pulmonologist, etc. And that's great when you have those zebra diseases. But when we treat any patient, it doesn't matter what the label is. We're one entire biological system. And so we must address the whole person because there are many, many facets to any disease. Every disease is multifactorial. And so medicine has gotten, I call it the new conveyor belt medicine, where, okay, you get this label and here is the protocol. Whether you have high blood pressure, diabetes, cancer, everybody kind of fits into this box. And no one takes into account how someone actually lives and how they got there. Because you are a bioimmune, energetic accumulation of life experiences, exposures, etc. And so we can't just look at, okay, your final appearance to the doctor with a situation, in your case, breast cancer, and not look at the entire chronological from in utero to where you are now. And so your body knows all those things.
Wow, your body does know all those things. And so then what you're saying is you look at what your patient is eating, maybe the environment they live in, exercise. So you're looking at all those facets.
Right. Well, I always, when patients come in, they don't necessarily understand integrative functional biological medicine. There's lots of different terms out there.
Right.
Like people don't know what functional means. People don't know really what integrative, and people really don't know what biological means. They kind of just know Western medicine.
Mm-hmm.
And so I always tell patients, like, it's an integration of like everything that we know today. And so like Western medicine, believe it or not, has only been around less than 100 years.
Man
has
think about that.
Man has been around for hundreds of thousands of years. And literally 100 years ago, there were no medicines. So doctors treated patients with potions and powders and homeopathy and all kind of things like that. There were no medicines. Okay. So they had to use things that they had existed then, which is kind of, unfortunately, a lot of it's tried to be destroyed. And so, but I always tell patients, yes, I'm a conventional doctor. So I've used conventional medical blood work and scans and x-rays and all that. It's beautiful. But at the same time, I'm also utilizing, stress reduction techniques, evaluation of someone's lifestyle. I'm looking at the bioenergetics of the person. So I'm using all these new, what I call updated medicine. People don't understand there's about 1.2 million PubMed articles per year. And so the new information that's coming out, every nanosecond, something new. And a lot of it's natural, a lot of it's energetic. We now know that all cells emit biophotonic energy, And so we've got to integrate these new updated things with patients. And so doctors should be always asking questions about, okay, tell me how you live every day. All right. What is your sleep? How much water do you drink? What do you eat daily? How do you move? And probably one of the most important things is, what has been the stress? If you have cancer, you usually kind of want to know what the stress has been in the last decade, the last 10 years. And because cancer takes from one cancer cell to tumor is about 10 years. So you want to know, okay, what significantly has happened in the last 10 years of your life? So if a doctor is not asking a patient how those very poignant questions, how in the world, I have no idea how they are going to take care of the patient, and medicine has been decimated to a surgery or a drug or drugs. And we cannot possibly take care of patients. We rank 43rd in the world in healthcare in the world, 43rd. So that means you're better off living in a third world country medically than you are here. We spend 2.5 times more than any other country. And 60% of our patients are walking around with a chronic illness, and that includes children. There's over 10 prescriptions written per man, woman, and child in the United States. And disease is only increasing, okay? Heart disease, despite Lipitor or statin usage, heart disease is still high. Cancer now is one in two people, for sure 1 in 2 men, about 41% of females. And the third leading cause of death in this country is the paradigm of medicine. And so we should all be asking ourselves, like I've kind of been singing the alarm button of 911 for a very long time, because all of these things I find can be we could prevent and early detection of diseases, whatever it is, okay? Look at the autism rates, okay? And I'm like, well, why aren't we all as a society alarmed about this? Why is cancer the leading cause of death in children now? We should all be immediately saying, we've got to change the woman that wants to be pregnant now. We have to get her and her spouse healthy before they even have a child. And so, because we all want to blame one thing for a disease, but there really isn't one thing. If you look, there's 100,000 chemical reactions taking place per second. The amount of things that influence that every single second is googolplex. And so we can't put it, as one etiology for a disease. All right. And so medicine, I know that medicine is trying to change, but we're about 20 years behind. And I say that because the doctor of today is just trained very robotically, unfortunately, to here's a surgery and here's a medicine. And I'm not saying that I don't recommend surgery sometimes, and I'm not saying I don't recommend medication sometimes, but I always try to understand why, where, when, and how this patient has this problem. And so, and today, unfortunately, if you look at the health of humanity, it is not good. All right. And so we've got to, you, me, and all the other people who are trying to create this awareness of health and prevention and early detection. We have to continue to try to make this a very contagious movement, because we see the life expectancy has gone down every year. We see the health of our people is not good. Diabetes is increasing dramatically in young people and everything. So we've got to emergently make changes.
It almost seems like it's kind of the frog in the pot. I'm sure you've heard that expression. And if you throw a frog in boiling water, they're going to jump right out. But it almost seems like our medical system is the frog in the pot. And, it's just slowly gotten worse. And we're not talking about it. It certainly isn't headline news. We've got so many other things in the news. And I'm just so sad that our children are really inheriting a broken medical system, and they're going to be sicker than their parents or grandparents. Is that an accurate statement?
Right. Well, that's interesting you bring that up, because in the last 4 months, the amount of young people, when I say young, 25 to 40, that I've been seeing that have cancer, it's unbelievably escalating. So I used to say that you kind of have a warranty until you're 40. And then from 40 to 60, you're on the semi-warranty plan, and 60 up, it's just repair, upkeep, and maintenance. And that's not good or bad. That is just life. But you can optimize. We now know, we have a lot of optimization that we can do now. And but now the amount of young people with cancer is alarming. And I always tell people that the children, whether young children or young adults, are the canaries in the mines telling us something that is, wait, there's something not good going on. And these are people they're not like, they're not like unusual situations. These are just like, whoa. I had yesterday afternoon, I had a 25-year-old melanoma on her forehead. All right. I had a 30-year-old with melanoma on her pubic area. And these are young people that, okay, they're not like terribly, like they're not really so unhealthy. Okay. And so you're just like, whoa. Hodgkin's lymphoma. Breast cancer. A lot of young women, they're breastfeeding, and they find a lump, and you're like, and these are people who are like, they're not that unhealthy people. It's not like they're just out of control, pre-diabetic, obese, and other medical comorbidities. These are patients that don't have any comorbidities. And so comorbidity is meaning other disease process. So we have to say, okay, what is going on? And I think personally, it's two things. I think it's stress, because I grew up in an age where, when you're 25 or 30, it's kind of, we were footloose, fancy free, happy, simple. I'll be 65 this year. And so it was a lot different environment. I didn't have a phone. I didn't have Instagram. I didn't have all this constant stimulation, and I wasn't sedentary, because you're moving around because you do, that's what you do. And I don't think people ate that great in that time period. But now I find that I think there's so much external stress and so much stress. And then the environmental pollution is now really out of control. And we've instituted, like in the last 30 years, all this new technology, industrials, revelations, and we haven't, it's all unchecked. It's all unchecked, like whether it's the water, whether it's the nanoplastics, whether it's the heavy metals, the pharma water, the EMFs, the whole, I think it's this environment of this whole environmental toxic soup that it's just totally unchecked. And so it's like cigarettes, cigarettes were advertised in medical journals, and as like, okay. And that took 50 years to realize, they cause cancer. And so we find out, 40 years later, oh, no, we shouldn't have done that. And so we need to get the microscope out, but the papers are all there, like the papers, whether it's the xenoestrogens, that's just one environmental toxin. I mean, if you look at everything else, I mean, you add all this up, and I tell people, no one can possibly, I don't care how brilliant you are, the synergistic potential of all of these exposures, and it's bioaccumulative over time, that I mean, I don't think anyone knows what that possible chemical soup and what it can do to your system. And so we all have to kind of, get our body in order, our body and mind in order. And there is this path, and we do know that because I see it here every day. We teach our patients how to live and think differently, and they get better. And, we know that. We know that. And, there's other big institutions that are trying to incorporate lifestyle medicine into a system. It's just, to turn those ocean liners around are so,
So
so
slow. And you're right. It's also, asking questions, and you might hear something from your local government or, whatever it is. And I think you have to ask questions. It kind of makes me think about, I grew up in California, Northern California, Chico, California. We were almond and walnut farmers. And I remember as a kid, we had some sort of a fruit fly that was hitting California. And so these crop dusters would come through and just dump, however many tons of malathion all over our neighborhood. So we were not allowed to go outside for 15 or 20 minutes. And then all the malathion would be gone, and we could go outside and ride our bikes and play and all those things.
Right.
Right. So we did grow up in a very toxic environment, and it's, I completely agree with you. It's not getting better because we're adding more things to it. So yes, maybe we're not spraying fruit flies with malathion. We're not putting mercurochrome, which was kind of a mercury-based, which I remember I couldn't wait to get scratches so I could get that really cool, mercury on my skin to be an antiseptic. And so, yeah, we didn't know. We didn't know what we didn't know. And so now we know a lot, but we also have more things that we need to be wary of. Would you agree with that?
Yeah, totally. I mean, look at the glyphosate with Monsanto's weed killer. Okay, I mean, they're using that everywhere, and it's in the air, and it's on the crops and everything. And we still know we know that it contributes to cancer, and that's why they have thousands and thousands of lawsuits. But again, it's still being used. So it's like other countries don't allow it, and we do. And how is that okay? All right. And then look at the GMO, they instituted GMO. Oh, this is great. This is wonderful. But now, if you look at all the scientific studies, it's not so great and wonderful. I know because I'm a victim of a drug that was used a long time ago to prevent miscarriage and bleeding in pregnant women. And, they knew that drug, they used that drug for 42 years before. They knew it was carcinogenic, and they were still using it.
Really? Is that DES?
DES, exactly.
Yeah.
And so, they knew all this, but we're continuing to do this every single day in medicine. I mean, if you look up any medication, it has a slew of 1,000 side effects. And I'm not saying that I never use medicine, but I usually tend to use old medicine. And then a lot of things you can fix literally with lifestyle intervention and, targeted nutrients. And I know because I've been doing this for 35 years. And these pearls, weren't just, they maybe just not around now. They've been around for years and years and years. And so we've got to, for one, learn from history, but two, incorporate these things that are non-injurious and non-immunosuppressive to patients. But in disease process, when we work up patients, we need to work them up to optimize them. Okay. If you optimize them, then I only see them once a year. I don't see them every week or every couple of weeks because they're here with stage 4 cancer or some other, very serious illness. And so we've got to do it. And I always say that self-care is the new healthcare. You'd be better off just really learning how to master your self-care, and then you'll have less likely, and then you can go verify it with a physician, a functional integrative medicine physician, who can say, yeah, this is kind of some fine tuning you need to do. And so, the way we work up, even though now I work up a 25-year-old, just like I work up a 55-year-old now. And the reason is that because I'm seeing so many young patients, because one of the other big things that I see is so much hormonal imbalance, because the toxins really influence our hormones and the production of hormones. I mean, if you look at just in males, testosterone, I would say probably 80% of males have low testosterone, all right? And they're 25, 30 years old.
Really?
And they said,
which they should be driven by testosterone at that age.
Exactly. And
more testosterone than brains, my husband will say.
Right. And the testicle size is decreased 50%. So this should all of this should be so alarming to really our society. I mean, let's forget all these other big things in corporate. We need to think about, wow, what is going on with the human being so that our society can continue and can be successful. And so, because a lot of people that are, autism experts, I am not an autism expert, but they talk about like, how can we continue this? This is not okay. I mean, when I went to medical school, there was like a paragraph on autism. Now there's libraries on autism. And people talk about autism, but we need to say, how are we going to prevent autism? All right. And again, autism is not one illness. The mother is downloading tons of toxins. We know that by looking at their blood, their breast milk, the placenta. We know that. And I think it's just like this, perfect storm of everything that's creating this. And creating these weaknesses. And, we talk about epigenetics. Epigenetics is how something influences your own genetics. And so it's not like you're genetically predisposed. No, you're not genetically predisposed, because genetics takes, many generations, right? But it's how this exposome is what you are exposed to in your whole life, and how that's going to physically, mentally, emotionally manifest. We know, like emotions, for example, people don't realize we have an emotional DNA. And that goes back, they say 9 generations now. That's what it used to be, 5, and now the science shows 9. And so anyway, so we also have to, we never in medicine really think about, how I never think about that. So, and, the latest things, like they say from what's in utero to 7 years old, 7 years of age is the most profound time in your life. Like, and who remembers what happened to them at 2 years old? I mean, I don't, you don't. And so, so that they say is like the most profound experience. Well, who asked you? And then how do you know? So that's why you have to have an outsider person, objective, going over your, I call it transgenerational analysis to see what those things affected you, right?
Right. Asking questions. It sounds like just asking questions. Interesting. So do you think, Dr. Connealy, this is why you're seeing more cancer in that 25-year-old-ish to 40-year-old-ish because of the toxicity of the parents.
Right. Well, not just parents, toxicity of parents, and then everything they're exposed to. And it's like this perfect storm. And you're like, and what I have always seen some young patients with cancer, but now in the last 4 months is when we've really seen a dramatic increase in young people. And so I'm like, whoa, what is going on here? And one of my pet peeves is electromagnetic fields. And so a lot of people have, they poo-poo, that understanding. But I've been researching it and reading about it for literally 14 years. And I know that there is a significant, because I'm not the only person studying it and researching, but lots of people are talking about it. There's, tremendous amount of scientists worldwide, not just in the US. And people poo-poo it because it's invisible. You don't see the energy frequency of your phone and iPad and cell towers. You don't see it. Okay. So if you don't see it, it's not there. But they found that, if a gentleman put their cell phone in their pocket, their fertility went down. Now they're saying an increase in colorectal cancers in people because they wear their phone in their back pocket or in their front pocket. So you're changing the energy frequency. So it is a real problem. We have like glioblastoma. Okay. We never saw glioblastoma before. Okay. Now we're, seeing glioblastoma. I mean, come on, this is unbelievable.
Unbelievable. And can you remind the audience what glioblastoma is?
So glioblastoma is a cancer that is manifested in your brain. And I tell people it's like an octopus. So it's got its main part of the tumor with tentacles. And everyone needs to understand that cancer just doesn't appear unless you're in Chernobyl, okay, or exposed to, nuclear, power plants and nuclear, explosions. That's when cancer grows real rapidly, okay? And people can watch Chernobyl and you can see what radiation does to your body. It was a great series. But cancer takes, about 10 years. Your body's so wonderful and smart and resilient and adaptable. But at the same time, we've got to respect it and treat it properly to create this homeostasis that we're trying to achieve every day. But, I tell patients, you're not living in a petri dish where I'm controlling the medium every day. You're exposed to thousands and thousands of different influences. I mean, think about it. When you sleep, okay, and your room is an electrical, you've got TVs on and
you've got a Wi-Fi
lamps
router.
Wi-Fi routers and smart meters and the extraneous from all the neighbors coming through your windows and doors. And then, okay, do you have mold in your house? Do you have chemicals in your house? What kind of chemical cleaners? I mean, if you do a forensic analysis of everything and how you live, from the shower water, it's got chlorine, fluorine, pharma water, toxic water in there. Okay, what are you drinking? You must drink purified water because the water is contaminated. All right, it's terribly contaminated. And then you think about the lotions and potions and stuff that you use on your body, whether it's the shampoo or creams or lotions, et cetera,
makeup.
et cetera.
Mm-hmm.
Yeah. And then, okay, what do you use in your dishwasher? Most dishwasher soap is terrible.
Okay. I didn't know that.
Yeah. I mean, terrible. All right. And then, what kind of dishes do you have? Lead laden arsenic dishes, or do you have, dinnerware that is proper and not you're ingesting it? And then, they just found out, I'm sure you probably saw about the nanoplastics they found in blood now. So we're eating about a credit card a day of nanoplastics. Okay. So if we're eating it, that means all the things you're eating have it also. Okay. So, and nanoplastics are very, very difficult to remove. Probably infrared sauna is probably the best way.
That's what I'm hearing as well.
And now we have these new, in medicine, these new filtering plasmapheresis that can filter your blood. And so that will be a beneficial technology for the future, because unfortunately, we're probably all going to have to start filtering our blood because there's so much toxicity. And then if you talk to all the environmental, last year they had the American Academy of Environmental Medicine, which they have every year. And, none of the speakers talk to each other. And every single one of them said that, environmental pollution is our number one concern. And so, but what are we doing about it? Because I was getting ready to do something on plastics, and they've been suing the plastics industry for like 20 years, and it's a $25 billion industry. Well, nothing's changed. Just like glyphosate, nothing has changed. So I tell people these industries are so powerful that money exceeds, the value of health. And so that means you've got to create your own personal sanctuary, your own personal space as good as possible, and start incorporating these counterbalancing techniques, whether it's sauna or detox baths, your eating, stress control, all of these things to create this homeostasis that you need. And then it's very, very, very clear where we are, because all you have to do is stand on any corner and you'll see the health of humanity. It is not good.
We had such an amazing conversation about cancer prevention. Tune in next week for part 2 of my conversation with Dr. Leigh Erin Connealy. One of my favorite supplement companies is Seeking Health. This company was created by Dr. Ben Lynch, author of Dirty Genes. I'm a huge fan, and one of the products that I love so much that he's created is this liquid vitamin D. My body has a hard time breaking down supplements, so I love the flexibility of having liquid vitamins. And I started this product a few weeks ago. I went to get my vitamin D tested, and it had gone up significantly. So I was thrilled with the results. And use the code ENOSMAY22 for 10% off your order. Thank you for joining me today on the Why Did I Get Cancer podcast. I've got my shopping guide for all of my cancer self-care items in the show notes, along with information about today's guest and our show sponsors. And don't forget to subscribe to my podcast so you never miss an episode. Keep in mind, I'm not a doctor. I'm just a gal that got diagnosed with cancer and wanted answers. If you need medical advice, please be sure to consult with a medical professional. And thank you for listening.